I'm Marina Flores, and I'm part of an area in Reinserta, which is focused on monitoring and evaluation of the programs that are implemented with beneficiaries. And also, the other part of my area is focused on the research. So every year we create a study related to children and adolescents in contact with violence. So this is the main topic that we develop into the studies that we create. So we have here a topic, an interesting topic. But first of all, I want to tell you something about the background, some facts that we have in order to have the evidence for the models that we implement in Mexico. So as you know, the violence against children and adolescents has claimed the lives of many children and have destroyed different families. So in Mexico, one of the main problematics that we have is the organized crime. The problem that organized crime has been increased during maybe the last 5 years. So almost 500,000 children and adolescents are recruited by organized crime in Mexico. So children and adolescents are recruited by criminal groups between the ages of 9 and 11, and in some cases at even younger ages. So they have different roles into the organized crime. For example, they carry messages between members of the organized crime. Also, they gather information or steal, kidnap, or they even kill other people to have money or to have power into the organized crime, into the cartel in Mexico. So this is one of the main phenomena that we study in Reinserta. So because of that, this is the base of all the models that we implement. Also, we have other facts. For example, Mexico has ranked as we have the first place in the world in child pornography consumption. So, well, this is a data from 2018, but well, this is a this is a kind of problem that we attend also. We have the second place in global child pornography production and distribution, and the first one in Latin America. So among OECD countries, we have the first place in sexual violence against children and adolescents. So, well, this is another fact that we have here in Mexico. I want to show this map. It is focused on the peace index in Mexico. It is also the base that we collect to have more evidence to create the models. So this peace index in Mexico, for example, if you see the images, you can see that in red there is a represents the least peaceful states, and the green represents the most peaceful. The least peaceful states are concentrated in the north of the country. So you have red and also orange. And at the south of Mexico, we have Quintana Roo as a state in red. And in the center of our country, for example, Guanajuato, Colima, and Morelos are states that have that scores in terms of peace. So, well, this is another phenomenon that is related to our problematic, because when we are in a state where doesn't have, or where there are not peaceful culture, maybe we tend to normalize the violence. For example, children and adolescents tend to normalize violent practices into the families, into the schools, into the communities. So because of that, we want to transition to give an opportunity to them for decreasing the effects of the violence. So we have here some facts related to normalizations of violence. For example, we have that 48% of children justify the violence. In the case of adolescents, the percentage decrease. It has a 40%. For example, also parents and children agree that violence against them at home doesn't cause harm or abuse. It is another kind of problematic. And also social norms give parents or authorities figures the chance to use punishment or aggression that has negative consequences for children and adolescents. A phrase that is very famous here in families is "I hit you, but I don't hurt you." It represents the normalization of the violence that are part in families in Mexico, or most of the families in Mexico. Also, violent parenting practices have been passed down from generation to generation. Parents who have experienced violence in the childhood are more inclined to use it as a method of controlling their children. Also, children make a direct connection between learning how to behave and the use of violence both at home and at school. And also, when children are physically assaulted at school, they generally don't report it. So they tend to, I don't know how to say that. Well, they don't say to the parents when they are violated in the school or in another context in the family or in another context. So this is a kind of secret when they are violated by other people. Also, we have another phenomenon that is included in our models and in our intervention. For example, the adverse childhood experiences. We have detected in our population, in our target population or beneficiaries, that most of them have different adverse childhood experiences. And as an explanation in our models, we have this pyramid. So it is from the conception to the death. So when children and adolescents have adverse childhood experiences, they tend to have social, emotional, and cognitive impairment. And in the next step, they adopt health risk and behaviors. And also they tend to have diseases, disabilities, and social problems. And maybe they have the early death. So this is a consequence of being exposed to adverse childhood experiences. As many as 60% of children have experienced a significant traumatic event. Traumas could be domestic, community-related, school violence. So this is another kind of explanation that we have incorporated to our model and evidence. Being exposed to these adverse experiences have different consequences in terms of biological consequences. For example, the change in the brain. Adverse experiences, such as experiencing violence environments, have a significant influence on cognitive, physical, emotional, and social development. For example, we have here in this image the comparison between the normal brain and the atrophied brain. So the normal brain of a child who has not suffered adverse experiences appears larger and healthier. And the atrophied brain with blurred structures and smaller, the result of a child who had suffered adverse experiences. So, well, this is the difference between those brains. And yeah, it is a consequence of complex trauma or adverse experiences. Another consequences of the complex trauma in early age are they have challenges with bond and relationships. Also, they have difficulty regulating emotions and behaviors. They tend to dissociate themselves from reality. They have general negative outlook on the world. And also they have challenges related to attention span and other cognitive abilities. So we can conclude that a child who has experienced complex trauma may have problems with relationships and bond, or difficulty regulating their attention, emotions, and behavior. So, and also, if we come back to the slide, also there is a consequence in the brain and in the development of the brain. As you know, Reinserta has developed different studies related to this problematic and phenomenon. One of them is the study related to risk factors and victimizations in adolescents who have who are in prison or in detention centers in Mexico. So this study reveals that high trauma scores, people reveal high trauma scores, especially in those who tend to start their criminal life at an early age. The other study that we developed was children and adolescents recruited by organized crime. So there are different conclusions in this study, but there is a pathway that begins with complex traumatic exposure and culminates in involvement in criminal behavior. So they tend to have problems at school, difficult family relationships, obviously, substance abuse, sexualized behaviors, risky behaviors, and crime incidents or recurrence. Also, this study shows us what is the process that organized crime follow to recruit adolescents and children. And obviously, they tend to use children to give them different roles, like kidnap or kill other people. So they tend to start criminal behaviors when they are very young. The other study that we developed 2 years ago was exposure to violence in the childhood and adolescence in people who are in prison. This study was the collection of information was in social reintegration centers here in Mexico with people who were in prison. So there we have different conclusions, and we have facts here. For example, 74 of the incarcerated population who was interviewed reported having experienced some adverse experience during their childhood or adolescence. Also, 86% felt unloved or unimportant in those stages of their lives. 85% lived with someone who was depressed or had a mental illness. Also, 85 lived with someone who had been in prison. So the context of that people tends to be criminal. Also, the majority of people in prison reported that their mothers and fathers were not present during their childhood. So they were alone, or where they grew up with other families, with other relatives. And also, the escalation of substance use was identified as beginning before the age of 6. And more than half of people in prison validated food deprivation and the use of physical violence as effective parenting practices. They present that in family. Because of that, we have the other phenomenon that this is the normalization of violence into the families, especially in some Mexican families in the north and in the south of the country. So it is mainly present in those parts of the country. We have some testimonies that are associated with this problematic. For example, people who are in prison or who have been our beneficiaries have related that, for example, my mother also suffered from violence. My stepfather hit her and burned her with pants. She never fought back. I suffered a lot of bullying in elementary school, which is why I became solitary. I prefer to be at peace. I feel very anxious, locked up here. I take medication to help me sleep and at night because the panic attacks won't let me. I have nightmares. I dream of blue knives, dead people. When I wake up, I run out of air. I feel like I'm suffocating. So those are testimonies, real testimonies that we have collected during the implementation. Well, as a solution, as a kind of solution for that problematic, Reinserta's model has created the the personnel in Reinserta has created this Reinsertas model, which has 3 different programs. One of them is childhood in prison. This model attends children and adolescents who have reference in prison. The other one is the model of survivors. And the last one, the social reintegration model. The survivors model is focused on children and adolescents who have experienced violence. And the last one is social reintegration model. It is focused on adolescents who are or were in conflict with law. So the social reintegration model have different axes. This is the social reintegration model. The first phase is the phase of diagnosis. The second one is intervention. The third one is the link up. We transition with the community. The fourth one is follow up, and the last one is mentoring. All the models that we implement with beneficiaries or with the target population have different axes. In terms of social reintegration, we have mental health, education, community reintegration, art, culture and sports, restorative practices, employability. And this model is divided into context inside prison, when they are in detention centers, and outside the prison, when they when they are incorporated to the community. So we attend them in terms of mental health, employability, and also education. This is the first model. The second one is childhood in prison. Here we have 3 different phases. The intervention phase, which has 3 programs. The adaptation of spaces into the prison. We adapt spaces, for example, into a detention center or a social reintegration center. We have an area which is specialized for attending children who visit their parents into the prison. And also we have places to play for children, especially for children. And this is the objective of the first program, which is adaptation of spaces. The second one is attention to children. This is in terms of parenting and also the childhood development. The last one is parenting school. It's a kind of, in this program, we give mothers and fathers different abilities to have or to parent a child. So, for example, we teach social abilities. I don't know how to say crianza. Well, something related to the education for parents, in how to grow up to accompany children in the next stages of their life cycle. The second one is the transition phase. In that phase, we try to, like the name says, to transition the children who are in prison to the outside. In that phase, we want to teach mothers how to transition with their children to stay outside the prison. So we have some program which is transition abroad, and the other one is we trying to strengthen the triad, which is formed by mother, new caregiver, and the child, or boy or girl, which is transition to the outside. And the other one is follow-up phase. In this phase, we attend children and through a specialized team. And it is focusing on children and adolescents also. This is the second model. And the third model that we implement here in Reinserta is children and adolescents who are survivors of extreme violence. Sexual abuse could be a kind of violence that they experiment. Also, another kind of violence, physical abuse, psychological abuse. They are the problematics that we attend here in the center of Reinserta. So this model has 2 phases. The first one is the intervention phase, which has different processes. The first one is contact stage. The second one is the stabilization stage. The third is the trauma reprocessing stage. The other one is the stage of reintegration into everyday life. And it comes to transition stage, to the second phase, which is follow-up. In the follow-up phase, we stage of consolidation and progress. We try to maintain the ability that they acquired before. And at the end, we closure the stage. So this model has different axes as the other ones. Psychological is the first one, family, psychological, legal, psycholegal, pedagogical, and cultural recreational. Well, those are our models, and they were implemented during the last years that Reinserta has operated in Mexico City, State of Mexico, and Nuevo León. Children and adolescents who are survivors of extreme violence, for example, many of them have experienced multiple chronic and generalized trauma. Exposure to violence increases their risk of emotional, behavioral, and developmental problems through their lives. We have attended, by 2024, 91 survivor children and adolescents. And in this first semester of 2025, we have 86 survivors in intervention and 5 survivors in follow-up phase. And well, we have good results from these programs. So well, those are our results. So they have adherence to our intervention, and also they have high levels of satisfaction related to the intervention. So they have decreased the symptomatology of trauma. And also they have been accompanied by specialized team. So well, those are the best results that we have present here. So well, this is the this is the last slide. So as you can see, I tried to give you the background, the phenomenon, and also I want to present the intervention that Reinserta has, and also how we can generate evidence related to this problematic. So, well, this is my presentation. This is my this is the fact. So if you want to ask something, feel free.
Thank you. Thank you very much. Muchas gracias, Marina. That was a fantastic presentation, and considering you were doing it in your second language as well, all the more impressive. Terrific.
Sorry for that. If I stop in some parts, sorry for that, because
no, it was exceptional. Look, we do have some time for discussion and questions, and so I might turn it over to. I see there are a couple of questions popping up in the chat. I'll just invite people to unmute if they're happy to do so and ask any questions they may have.
Yeah. Can I read at the chat here?
Yep. I think there was one from Lindsay and then one from Matt. So do either of you want to...
Thanks, Marina. That was really interesting. I'm Canadian. I spent a bit of time in Mexico, in Quintana Roo and Yucatan and in the Baja California Sur. And it's interesting to see the different peace indices. I didn't know about that. I have so many questions, and I was also in Vancouver and saw Anna speak at the Youth Mental Health Conference, so a little bit familiar from that. Yeah, I guess a few questions I have. I don't want to hog the conversation. One is, how do you work with the local justice facilities and all the settings that you go into? Because I know we have a big challenge with that in Australia in terms of accessing young people in those settings. Like, do you find the departments of justice, or however it's organized in Mexico City, is quite open and welcoming of your program coming in and engaging with young people? And do you have any challenges with that, or Anything that you've learned that has really worked well?
Yeah, well, we have different agreements with authorities into the different facilities. For example, in Mexico City, State of Mexico, and also in Nuevo León. So we have implemented our model in 3 states in Mexico. So we have different agreements. We need to give the authorities the program that we want to implement, and they know the program, and also they help us to implement into the different detention centers or social reintegration centers. The detention center is for adolescents, and the social reintegration centers are for adults until 29. So those agreements help us to uh, to implement during the cycles that we need to give the intervention. So we have a good relationship with authorities here in Mexico, with penitentiaries and penitentiary authority, and also other detention centers. So this is a part of our challenge, yes, but nowadays, after 10 years of the implementation of our model, it could be better, and it is better every year. Yeah.
And I guess I just have a follow-up with that. How did you start out the program, and how did you start making those relationships
Well,
for it to
first of
work
all,
so
is
smoothly?
maybe we start with the small actions. For example, we send a kind of um, a letter which contains the main access that we want to implement, and they answer, and we ask, and they answer, and this is a kind of logistic that we develop with authorities. But well, it has function. This is well, yeah. It has been good for us to develop the implement the intervention.
Thanks. And final question before someone else
Yeah.
answers. I just put in the chat. You presented some information on evaluations and the outcomes. Have you published those? Are they online at all?
Depends on the founder. For example, some of those studies that I present are in our web page. So, but the results of the evaluations are in the annual reports. Every year we publish all the annual reports, and those annual reports have the information of the results that we have. But sometimes when the founder or the the founder mainly ask for them, we can send the results and of the evaluation. Or
Sorry, Stuart, go ahead.
No.
I can keep asking questions, but
No, Lindsay,
Yeah.
please
Sorry.
hang on to them, Lindsay. We do have time, but I might, if you can hang on to them
yeah.
for a bit, I might. I know that Matt had a question there. I'd love to hear Marina's reflections on that as well. Matt, please go.
Yeah. Oh, hello, Marina. I'm Matt. I've just got a couple of questions about how many people can be in the program at once, how scalable it is to the population at large.
Yeah. For example, in social reintegration model, we have every year 200 people in our program. In survivors, the beneficiaries are maybe 90 more or less. And in childhood in prison model, we have, for example, 50 children and maybe 80 mothers or parents. Depends on the intervention, because, for example, childhood in prison and social reintegration model are interventions in a group modality, and survivors model is in an individual modality. So because of that, the population is small.
Yeah.
And yeah, we have different protocols that are useful for scale the models and scale the practices. One of the most famous, I can say that, is the social reintegration model. We have different protocols and manuals, and these model has been replicated in other states. We started in Mexico City, and then we scaled that in state of Mexico, and then we scaled in Nuevo León, and other authorities has asked for the replica of the model in the different detention centers in Mexico. But for one or other reason, it can be finished. But well, we have this possibility to replicate and to scale to other states in Mexico. Until now, I can say states, but maybe it could be in countries.
Okay. Thank you.
Thanks, Matt. And there's a really nice follow-up question there from Monica Cass. I'm wondering, Monica, do you want to read that out, or would you like me to just read that for you? Oh, there you are.
Sorry.
We can hear you.
You can, no, just a really quick question. Just wondering where your funding is coming from, and also, I guess, a follow-up question to that is if the funding source sort of assists you with your entry point into those particular facilities.
Sorry, I can't hear you, but I don't know if the question is here in the chat.
I think there are two questions. The first is just the funding for your programs, Marina. Where does Reinserta get its funding from?
From companies and from other foundations which are interested in the problematic or in the problem related to violence against children and adolescents. So companies and also other foundations. We don't have a lot funding from government. Maybe 1 or 2 years we have that kind of funding, but it is rare.
Does the funding source help you to enter into those particular institutions? Does it depend?
No, it depends. It depends of the company, but the facility to go inside the detention centers is from Reinserta. Reinserta is the main contact to the authorities. Yeah.
And Monica, was that your second question as well, or was there a follow-up question? Yeah.
No, that's fine. Thanks.
Right. And look, Monica, I was fascinated when I was there to learn that most of Reinserta's work is funded by the private sector and foundations and not by government. That's very different to Australia, and so it's a really important lesson for us. And I wonder if you could just comment, and I don't want to put words in your mouth, but my sense is that Reinserta has a very strong trusting relationship with government, which you need to access detention centers, but also independence because you're not funded by them. Would that be fair to say that you have perhaps some opportunities that a lot of organizations in Australia don't have, because a lot of our funding does tend to come from government?
Yeah.
Yeah. That's a simple answer. Thank you.
Yeah, I don't know whether if you want to. I was reading the last one, which is from Lindsay. Sorry.
Lindsay, yep. Yeah, please, Lindsay. Yeah. So, oh wow, we've got questions coming hot and fast now. Lindsay,
Because I
Pascal,
got
Graham,
distracted.
then Cameron. So
This will be my last question, and I'll email you the rest, Marina.
Okay, perfect. Yeah, I was distracted. Sorry, Stuart. I don't know what.
Oh, good. This kind of relates to the scalability question and the evaluations, and I'm wondering if you've done any looking into if there's different, like, is the program more effective for some young people versus others? And you mentioned the backgrounds of adverse childhood experiences and trauma, as well as the structural influence of gangs. And I would imagine, that is such a challenging thing to overcome when young people are in the community, even with the best supports. And in terms of the evaluations, what are you learning in those regards with, is it like, I think a lot of programs seem to work really well for the people that kind of have the least challenges, but are you finding that it's also effective for the people that are experiencing a lot of adversity and trauma and really deeply integrated and impacted by the gang culture?
Yeah. The results are better when they are younger. It is a fact, because they are not exposed to different adverse experiences. So when they are, for example, adolescents or younger or a youth, population, it could be difficult to intervene with them, but it is not impossible. It is difficult, and we have other variables that we need to take into account. But yeah, we have better results with children and with younger people. Mhm.
And could you say a little bit more around like what types of other approaches do you take with the older adolescents or young adults in that circumstance that you find does work?
Yeah, we try to adapt the intervention to different stage of the life. Because of that, we differentiate the intervention of the programs and also the evaluations, because not all the instruments or tools that we have are the same. We have some evaluations for children and other for adolescents and other for youth, in order to have the differences and to check the necessity of every population. So because of that, we have different results, and also we need to adapt the intervention to every population or to every stage of.
Awesome. Yeah, thanks. I'll take another look at the website, but it's just such amazing work. So well done to you and
Thank you.
your colleagues.
Thank you, Lindsay.
Yeah. Thanks, Lindsay. Excellent questions as always. Pascal, did you want to go ahead and ask your question?
Yes, sure. Thank you. Yeah, that was quite an incredible presentation. Thank you so much.
Thank you.
Maybe my question is a bit similar to the one that Cameron asked afterwards. But once those children have gone through the program, they had the intervention, they obviously feeling better and ready for insertion. Yeah, then what happens? What's the follow-up? Do they go back to their environment, their family? What kind of long-term effect do you provide for those kids to actually keep them safe and away from their criminal environments?
Yeah, it is a possibility. They tend to return to families, violent families or criminal families, but we follow up during the 6 months or 1 year after they leave the program or after they leave the detention center. So after that, we try to follow up, to stay in contact, to give them other contacts, or we refer people or adolescents to other institutions in order to maintain the school and the work or the job, sorry. And we try to follow up, and after that, we try to maintain the abilities during the 6 months and the year. We try to maintain these abilities in order to reduce the possibility to, for example, in the case of adolescents, to the recidivism in the case of that. So, but for example, with survivors, it is difficult because sometimes the aggressor or the person who violated him or her is part of the family. So we need to start a kind of a justice process to help them to separate the child or from that family, and we try to refer to other part of the family, to other relative, and yeah, we tried that, but it is a difficult action, and it is a kind of challenge that Reinserta has every day.
So in effect, you are trying also to rehab the family or the parents. That's part of your program, to eventually re-educate the family and decrease the risk of violence towards the children.
Yeah, we the survivors program has a family intervention. So in that intervention we work with abilities, with the in order to generate awareness about the importance of being in therapy, or being aware of how to educate children. But well, this is a challenge, but we try to implement in our program.
Thank you so much.
Thank you. Great question, and it's a wicked problem, isn't it? Doesn't matter how good a program is, achieving sustainability when people return to challenging environments is always difficult without changing society as a whole. Maybe that'll be the next challenge for Reinserter, to wholesale change Mexican society so that children are returning to healthier environments. Look, there's a question there from Graham. Graham, would you like to go, please?
Thanks, Stuart, and thanks so much, Marina, for your presentation. Fantastic work. I'm just really interested about, so two questions. The first one, in your presentation, you showed a map of sort of the different regions and the different levels of violence in those particular regions. I'm just wondering whether you have any insights in terms of some of the drivers for those levels of violence within those particular regions. And my second question is about the actual interventions that you actually do in groups and with individuals, what those specific interventions are, and who are the people who actually deliver those interventions?
Okay. Regarding the first question, yeah, we have assumed that the difference between the regions and the kind of violence that those regions present is because the how to say, barrier, or well, they are next to United States. Sometimes this transition to the other country tends to provoke those kind of violence contexts, because, for example, in the north of the country, there are a lot of cartels. So because they are in a step from abroad, so they tend to change the culture, and probably the education is not important for them. The importance that they have is passing the drug, and we need to educate children in those zones to sell and to pass the drug. So because of that, the violence could be an hypothesis from our studies. And in the south, because also in the south we have some regions that present the same problematic that in the north. So we assume that, and also maybe it is related to the cultural aspects, how they educate people, how they live in family, some conservative practices into those regions could be another hypothesis. So yeah, and related to the group and individual intervention, well, for example, in the social reintegration model, we have a team which is expert in the field work. So they give workshops, and in the workshops, not just work in the cognitive aspect, but also they work in the practice, how to change my behavior. Not just, yeah, I'm depressed, I was part of the organized crime, yes, but how can change that through different practices? So this is a kind of education that we give them into the groups. When it's an individual intervention, we have therapists focused on psychotrauma. So this is the main guide that we implement. So the psychotrauma is the base of all the interventions, and in an individual intervention, therapists need to be formed in that intervention in psychotrauma. Because of that, they could offer a better intervention. So.
Excellent. No, thank you so much.
Thank you.
Thanks, Marina. And then there is that follow-up question from Cameron, which I think does kind of build on the one that Pascal asked before. But Cameron, is there any, just hearing Marina's response so far, is there anything you'd like to add to that?
Oh, yes, thank you again, Marina. I suppose before even those statistics popped up, I was wondering whether the desperate need in intervention and transition meant that that there was less focus on the actual follow-up, because people are trying to deal with trauma in the earlier stages, and then I did see that there was only about 5 people in the follow-up group. So I was wondering if that's a matter of resources, or because sometimes there's people that you've lost contact with, or other reasons.
Yeah, well, we try to follow the beneficiaries from the first phase to the last phase. But sometimes, yes, it could be possible that at the end of the model or the last phase, we lost people during that period. But it is because sometimes they have said that I want to return to organized crime because this is my life. Another, maybe I'm not, I don't have the possibility to go to the Reinsertas center to attend myself. I'm not interested in that. So those are the examples that we lost. And yeah, those can be the reasons.
Yes, thanks very much. Yeah.
Good research question there, Cameron. It's nice to bring it back to the research and the evidence. And Marina, can I just add that, I mean, it was a real pleasure visiting you guys in Mexico City, and learning what a robust monitoring and evaluation group you have within Reinserta. I mean, when I think about organizations in Australia that attempt to do similar sorts of work, often there's no funding or resourcing for the kind of evaluation work that you do. So I was really impressed that there's such a commitment to generating an evidence base to support what you're doing, and obviously more resources for doing that is always better. But I'm wondering if you could talk, if you can, briefly about how that's funded. How does an organization like Reinserta, that's doing all of this amazing work for young people in Mexico, also manage to fund this evaluation unit that you're involved in? Maybe there are things that Australian organizations could learn from this.
From the process of evaluation, yeah. Well, we have learned a lot of evaluation. We have been trained by other organizations, for example, in Canada, in United States, and from other countries. They have teach us how to implement a monitoring and evaluation plan. So thanks to that training, we have developed in every model an monitoring and evaluation plan. All the monitoring and evaluation plans have a mixed techniques. We combine qualitative and quantitative techniques. The quantitative techniques could be instruments validated in Mexico, maybe. If they are not validated in Mexico, we try to start a process of validation for some instruments. And in a qualitative technique, for example, we include focus groups, interviews, to complement the evidence that we collect with the quantitative instruments. So we try to have a triangle between qualitative and quantitative, and conclude, we have conclusions about not just the beneficiaries, but also the intervention in general, in order to adapt the programs, to adapt the interventions, the access from the programs. And to add, in the last maybe 3 years, we have adapted all the models. And for example, the social reintegration model has been adapted into the different phases. So we have added, for example, the restorative practices. And in survivors, we reduce the model that we planned at the first, and now we have 2 phases in order to be more concrete and to reduce the costs of the model. So, well, this is the experience that Reinserta has, because we have trained for people in other countries, for experts, and my team in monitoring and evaluation is free to take other trainings and to give us the knowledge related to monitoring and evaluation. So we are in contact with academic people and teachers from universities to adapt those scales and to start processes of validation. So nowadays we have a plan to validate one of the scales, which measures depression and anxiety. So we want to adapt this instrument because not all the instruments associated with mental health issues are adapted or are acquired for those kind of people. So this is our knowledge.